Good morning. This is Babak, Larian. How are you? We are doing a live Q&A session, question and answer for salivary parotid lesions, parotid issues, salivary gland issues. And I do have some questions that have come in and I would love to answer. You know, I really want to take advantage of this opportunity to address questions and issues for people who don't have access to healthcare right now, who don't feel comfortable going to their doctors, who really need some answers and are in a tough situation. And I feel like this is really an amazing platform to be able to help people who may not have the means, the access, or could be in a location where it's tough to get to. You know, the folks right now who are, in Oregon and have the fires to deal with and don't feel that their doctors are readily available to them, and all the other places in the world where all sorts of crazy things are going on, and this is a crazy time. So I'm glad I can do this, and I hope that I can help a lot of people with these sessions. In any case, I'll start with Doris Melgard's question. All right. Doris asks, they are telling me again that the 1 to 2 centimeter neck mass under my ear is just a parotid lymph node. This is reassuring only if I hadn't been there for 3 years. If it hadn't been there for 3 years now and continually getting slightly bigger. It would be reassuring if I didn't have elevated metanephrines, catecholamines, neuron-specific enolase, chromogranin, and cortisol, and ACTH. Yeah, I mean, Doris, those are things that happen with hormone-producing tumors. Carcinoid, for an example, is a hormone-producing tumor that does it. Carcinoid tumors are very uncommon in the salivary glands, although they can occur, but they're very uncommon. And so that is a concern and should be investigated more thoroughly. When is a lymph node just a lymph node, and when is it something else that needs attention? And unfortunately, there are a couple of other nodes starting to pop up and remain enlarged, unaffected by antibiotics. Let me finish what you're saying, and I'll look into it. I've been to my regular ENT. She doesn't know what to do with me other than repeat the MRI in 6 months. I've been to the head and neck cancer surgeon. He didn't feel down low enough on my neck to feel the mass, but he has felt more necks than any other doc in the building. I don't need that kind of drama. He dismissed me. The radiologist didn't even comment on the parotid lymph node. I had to look and then press the ENT about it. And then I'm concerned for MEN syndrome, considering I have small parathyroid adenoma. Just over 3 years ago, I tried antibiotics a couple of times. My brother had 2 surgeries to remove some parotid tumor. He passed almost 9 years ago from diabetic ketoacidosis. I'm sorry. His blood pressure was off the charts. There's something genetic going on. Well, yes. I mean, our father died of cardiomyopathy. We all have these crazy symptoms. Tachycardia, high blood pressure, flushing, high sugars, nausea, vomiting, on and on. I want to consult with you. Do you take any insurance? Yeah. Well, hopefully I can help you here, Doris, but I'm happy to talk to you as well. Things like this shouldn't be this hard. COVID chaos has made them 100 times worse. Thank you for willingness to help. I'm happy to do it. There's a screenshot of my MRI. The report didn't mention this. I forgot to mention that I have negative genetic testing for parathyroid adenomas, not parotid, parathyroid. I also just found on my routine thyroid ultrasound that I have a 7 millimeter nodule that wasn't there last year. I'm waiting for endocrine to order a 6-month ultrasound instead of waiting the 2 years as was recommended. All right, so much going on for you, Doris. And let's take a look at the image that you've put on. Here, let me flip the screen. There we go. So this is the MRI that Doris sent, and you can see these are cross sections in this orientation, the parotid gland being here, the scan is crossing right through it. So if you look, this is the front of the face. Back of the face would be, back of the head would be here. Sides of the face, you can see the earlobe here. The scan is a little tilted, so you see the earlobe on this side, but not the opposite side. You can see the tooth sockets here, tongue, and this is the parotid gland on the left side. This is the parotid gland on the right side, and you can clearly see this white lesion there. Let me expand it. And it's right superficially in the parotid gland. It is kidney bean shaped, which is an appropriate shape for a lymph node. It is very active on this image, which is a T2 weighted image. T2 means the water lights up, so this water around the spine is lighting up, and so is this. Parotid tumors oftentimes show up on this type of MRI, but a lymph node could be present as well. But as you can see, it doesn't give you much detail. It just shows you that it has a kidney bean shape. You can't see the internals so well, and so on. So, let me put it into perspective. I am of the thought process that parotid lesions need to be biopsied. You need to put a needle in that lesion to see what it is, right? So usually when patients come in, that is what I try to do, to get a sample to see what I'm dealing with, right? If the needle biopsy shows that it's a benign tumor, great. You know, we can decide to act on it now, or it's small and not growing and monitor it, right? It's a benign tumor that has the potential of being cancer, great, let's take it out. It's a benign tumor that does not have the potential to become cancer, let's watch and see its behavior. If it stays the same size and never grows again, leave it alone, watch it, right? If it's growing, take it out. If it's cancer, obviously deal with it. If you put a needle, put a needle inside, and all you get is a sampling of white blood cells, lymphocytes, which is what a lymph node would have, then you know you have a lymph node. And then based on that, you can decide what to do next. But Doris, I have a simpler suggestion for you. I would suggest that you do an ultrasound of the parotid gland. This lesion that you have is very superficial. This is your skin, this is the parotid, and less than an inch away from your skin is this lesion, right? And an ultrasound can very well show you this. Let me bring Dr. Google on and show you lymph node ultrasound. Okay, and we'll do the images. On ultrasound, you can see lymph nodes very well. So this is a good one. A lymph node, just like this one, is kidney bean shaped, elongated, and has a white line in the middle, right? This is a normal lymph node, right? And then as the lymph nodes get more rounder, like this one and this one, it become more suspicious, right? While again, a lymph node like this one that's oblong and has a white center, oblong, and a little bit of a white center. These are normal lymph nodes, right? So if you do an ultrasound and you see this configuration on that with the white center, right? We call them the hilum, right? Or the Hiller line, right? And it's oblong, you may not even need to do a needle biopsy. You may be able to tell that this is just a lymph node. Now, the parotid develops a little bit later than the lymph nodes. So as it's developing, it traps 3 or 4 lymph nodes within it. Those lymph nodes have a job to do. The job of lymph nodes is surveillance, right? They're army barracks. They're part of your surveillance system. We have 150 lymph nodes from the parotid in the neck all the way down to your shoulder, right? On each side, because there's so many ports of entry of bacteria and infections, you need all these lymph nodes to be ready to attack an infection. So they're army barracks. When an infection happens, they fill up with white blood cells and they get bigger. That's why when you catch a cold, your glands swell up. Those are the lymph nodes. And when they swell up and have the white blood cells in it, they're ready to fight. And then once the fight is over, they usually leave. Unless you have a chronic situation. So let's say you have chronic ear infections. You have gingivitis, gum disease that's going on for a while. Then the white blood cells stay in that lymph node for a long time, ready for the inflammation and infection to occur again and again and again, right? And that could be the reason. You could have something as simple as that causing that lymph node, in which case you don't need surgery. You just need more information, Doris. When I look at that, I am not very concerned, but I am not unconcerned, right? I do feel like I need a little bit more information to put my mind at ease that this is a simple lymph node doing its job. And I think a simple ultrasound can do it, right? Because the ultrasound gives you more detail, while the ultrasound will give you this kind of detail, you saw the MRI just show you a white round thing without any more detail. And I think you can get that information by doing the ultrasound and figure it out. So if you do the ultrasound and it looks like a lymph node, a benign lymph node that has the line, the hilum in it, then you're in great shape. Continue to monitor it. You don't even need to do an MRI to monitor it. You can do the ultrasound. At the same time you're doing ultrasound to check your thyroid, you can keep doing ultrasounds on the parotid and check that out. And very easily managed. Okay? So that's where I am. Now, if you do the ultrasound and it doesn't look like a lymph node, it looks like a more solid mass, right? Then I would definitely suggest doing a needle biopsy. And when you do the needle biopsy, you have to let the person who's doing the needle biopsy know that you have concerns because of the elevated metanephrines and things like that, that you may have a hormone-producing tumor, a carcinoid tumor causing it, right? So that they can be looking for that, right? The more information you give to the pathologist, the more things they can look for, because those tumors are not common in the parotid gland and may not be so easy to tell just with a few cells on a needle biopsy, all right? I hope that helps, Doris. I do these ultrasounds in the office. I do the needle biopsy under the ultrasound guidance in the office. Most head neck cancer surgeons, most head neck or ENTs that specialize in tumors of the face do have ultrasounds in their office, you know, and they do their own ultrasound to make these assessments, and I would highly recommend you find one, and if you want to come see me, obviously I'm very happy to do it for you, okay? So moving on to the next question. Debbie McLaughlin. Hi Debbie. Are parotid cysts rare? They're not very common. They happen rarely. Biopsy suggests cystic. Great. I'm due full parotidectomy within 4 weeks. Okay. Let me just explain parotid cysts first, and then I can move on to you having surgery, right? So let me flip this around. Let go of Dr. Google here. And all right, so this is the parotid gland. This is the submandibular gland. And this is the sublingual gland. They all produce saliva. And when they produce saliva, the saliva goes through the duct into the mouth, right? So the ducts here, let's make the ducts. So the ducts come in and they form by multiple other ducts coming together, right? Turning into millions of smaller ducts that go to all parts of the gland and collect saliva, right? Something like this. And then the saliva comes, so if you were to imagine, the saliva courses and then comes out to get out of the mouth, right? If there is something that causes blockage, if there is an inflammation in the duct here that blocks this area, right? Then the saliva that would normally go out can't get out and accumulates, right? And can turn into a cyst, right? So the duct essentially expands because it can't let the saliva go away, right? And so that's one way a cyst forms. Other ways that cyst forms, there are other ways that cyst forms as well, similar in nature, right? Cysts are generally benign, right? So the way to figure out what you're dealing with is when you do a scan, an MRI or an ultrasound, you look at the cyst and you see if next to the cyst, if there's anything at all, or if it's just the wall of the cyst and the fluid within it, right? Otherwise, it could be that you have a tumor next to it, right? So it could be like this. But the scan would show it. Let me do it in black so you can be better visible, right? The scan would show if there's a solid component. If there's a solid component on the scan, then when you do a needle biopsy, you're going to biopsy this part to see what that solid component is. So, Debbie, if you had the cyst that has no solid component to it, right? And you do the needle biopsy, it shows cystic fluid, some of the cells of the lining of the wall of the cysts here, that proves that you're dealing with a cyst, right? Then the only reason to do surgery is if the cyst is growing and getting bigger and bigger and bigger. That's the only reason to do surgery. If you have a small cyst in your parotid gland that is not growing, that is not getting infected, that is not bothering you, then the surgery serves no purpose. So that's what I would say, is that reassess, Debbie, what's going on so that you make sure that you're doing the surgery for the right reason, right? I have lots of patients with small parotid cysts that I follow. And I'm not blaming your doctor. I was trained by my world-renowned professors people would come from all around the world for him to do the surgery, that anything in the parotid gland needs to be removed. So that's what I was taught. That's what every ENT was educated on, right? But we hopefully have evolved since then, since 20 years ago when I finished residency, right? And my training, hopefully we have all evolved to be more critical in our thinking. Am I helping the person by doing the surgery? So, and Debbie, that's what you need to ask yourself, and that's what you need to ask your doctor. Is the surgery going to be helping you? If the cyst is small, not growing, not putting pressure on anything, and not getting infected. Then, All right, Liza Boronsuzian. I'm sure I massacred your last name, Liza, but, and I apologize. How common is it for someone to have cysts about 2 centimeters in the parotid gland, and what course of treatment would you recommend? Same thing, Liza. My belief in terms of cysts is that if they are not causing problem, then they should not be removed because they're just a fluid-filled sac. There were a few years ago, about 10, 15 years ago, it became a common practice that in the US at least, that people were doing full body scans and looking from head to toe in the hopes of finding tumors and cancers early on so that they would cure the patient early. And it was a nice thought. But what happened is that we found all sorts of lesions, cysts, masses, and things like that. And the process of trying to do biopsies and figure out what these things were causing more harm than we were helping. And so I have a healthy respect for not doing surgery on things that don't require surgery and watching and monitoring. If you have a 2 centimeter cyst, Liza, that's not bothering you, that's not getting infected, that's not growing, then I would say just monitor it. Don't do surgery. Especially if it doesn't have a solid part next to it that looks potentially suspicious, okay? Ibrahim Mahmoud Jamoon is asking, does Dr. Larian do surgeries in other countries? Unfortunately, the only other country I do surgery in is, at this point, is Guatemala when I go on medical missions. Guatemala, El Salvador, and Ecuador on the missions. I don't have a license to do surgeries elsewhere, but I do have a lot of patients from other countries that come here to do surgery, so I can help with the process of having you come here to do it if that's what you'd like. All right. Zarina Aziz. After a CT scan, we discovered that my 19-month-old son has a right-sided parotid tumor. Oh, I'm so sorry. That is hard. Due to his age, we are unsure whether to do a removal surgery or do a fine needle first. The surgery at his age might be a risk due to young nerves, but not doing surgery might allow the tumor to get bigger. What would you advise? What would be? Okay. That is a hard one. I would tell you what I would do if this was my 19-month-old son, right? And I have two of them, so I know the emotional experience you're going through. First, I would do a needle biopsy, right? Especially if you have not seen this mass to be growing, okay? Right? So if you, in the past few months, do not feel that when you feel your son's face that this mass is rapidly growing, then that gives you an opportunity to take your time and see if this is something that needs to be removed on an urgent basis, right? And if it's not growing rapidly, then what I would do would be the fine needle aspiration biopsy, okay? I would do that, and I know it's gonna be hard for your son, and I know that to do a needle biopsy on your son, he's gonna need sedation, right? That's a hard one, right? But that's what I would do. I would do a needle biopsy to see what it is. The chance of more aggressive tumors is a little bit higher in extremes of age, right? Old, and young. And so you need to know what you're dealing with. So if you do the needle biopsy and you find that this is a benign tumor, the type of benign tumor that's not going to transform into a cancer in the near future, then it gives you the opportunity to have time to see how the tumor behaves. And I would say you can follow this lesion, most likely being that your son is only 19 months old, with ultrasound, because ultrasound can see most of the parotid gland, and monitor with ultrasound rather than putting him through CT scans or MRIs, right? And ultrasound has no radiation and no risk to your son, right? So again, to summarize, if the mass is not growing visibly or obvious to you, right, then do a needle biopsy. If it's growing rapidly, then I think you have no choice but to do the surgery. If it's not growing, then do the needle biopsy. The needle biopsy is going to categorize the lesion for you. Lesions that need to be removed in a more immediate base, or lesions that can stay behind. If it's in the category that needs to be removed, obviously proceed with surgery. If it's in the category that it's not a cancer, it's not going to become cancer anytime soon, then you have the option of monitoring. And at that point, I would monitor it with ultrasound, which will be not only easy on your son, it'll be easy all around and have no harm, no radiation exposure. And that way you can see. And you know, if you have the good fortune of following this path of monitoring it for now until your son is a bit older, then you can reassess and see. Because if you continue to monitor and in the next 6 to 12 months you find that the lesion is not getting bigger, your son's getting bigger and growing, but the lesion is staying the same size, that would be a good thing. Then as it's growing, the nerves are growing, the parotid gland is growing, and this lesion is staying steady the same size, when he's older, if the surgery needs to be done, then you can do it on a person who has bigger nerves and bigger tissue to deal with, and can have surgery with less risk. Having said that, We do surgery on young kids. Unfortunately, we have to do surgery on young kids. And if it needs to be done, then it can be done. All right? Zarina, best of luck. I know this is an emotional roller coaster, and I hope our conversation has helped you. All right? Have a wonderful day. That's the end of the questions. If anybody has any other questions, don't hesitate to let me know. I'm happy to talk anytime. All right? Take good care. Best of luck. Stay healthy. Keep your masks on as much as you can. Get information about COVID yourself and analyze it yourself. The news is not necessarily the best source, unfortunately, for healthcare issues. Make your own decisions. Unfortunately, this virus is real, and unfortunately, this virus is aggressive in a person whose immune system is poorly reactive. You know, it's not an immune system that's weak or an immune system that's strong. It's an immune system that misreacts to the virus that gets us into trouble, and that's hard to predict. All right. In any case, best of luck, everyone. I'll see you guys next month.